Well, vaccinations are expected to begin in high-risk shelters across the city starting this week. Toronto Public Health says people experiencing homelessness have been added under phase 1 of the province's vaccine plan. And it comes after health officials confirmed at least 29 cases of a COVID-19 variant at the Maxwell Megan Centre, which has since declared an outbreak. February the 3rd, at least 4 other shelters have also seen outbreaks. So it's very clear we have a problem here. A lot of our shelters overwhelmed with these COVID cases, but now this positive turn. But when we're talking about this vaccination, there are a lot of questions. There is also some criticism. So to break it all down, joining me now is Dr. Naheed Dosani, a palliative care physician and health justice advocate. Good morning to you, Dr. Dosani.
Good morning, Melanie.
I want to start here. You've been a leading voice in saying, yes, we need this. We need these vaccinations to help those experiencing homelessness. And you have the stats to back them up. So let's talk about that.
Absolutely. It goes without saying that living life on the streets is hard. And during the COVID-19 pandemic, life has become even harder for people experiencing homelessness. This population is 2.4 times more likely to test positive for COVID-19, 20 times more likely to be hospitalized, 10 times more likely to be admitted to ICU, but most importantly, 5 times more likely to die from COVID-19 compared to other housed people here in Ontario.
Dr. Dosani, when you're very active on social media and you had to defend saying, listen, this is why it's important that those experiencing homelessness get vaccines. There were a lot of people saying, why are they ahead of other segments of the population? When you hear that, how do you back up this argument?
Well, it's the moral argument and it's the research argument that shows that basically if we don't vaccinate this population soon or prioritize them, they will die. This change in policy will ultimately save lives. There is a big misnomer out there that people experiencing homelessness are in the situation they're in because they did it to themselves, but it's actually not true. As a physician who provides healthcare for people on the streets and in shelters, I've never met a person who wanted to be in a situation that they're in. People are in these situations due to trauma, discrimination, and overall a lack of compassion in our society.
One of the hurdles here is the idea of vaccine hesitancy. So how do we overcome that hurdle?
Vaccine hesitancy is an important concept. I appreciate the focus on vaccine supplies in our discourse right now, but we need to be thinking about how to get these vaccines into people's arms, and that means winning over their hearts and their minds. People are somewhat fearful or anxious about the vaccine, particularly in populations that have a historical mistrust of healthcare. For example, racialized communities or people who experience homelessness. So we need to build trust. We need to build relationships. We need to build a connection with people so that they trust the COVID-19 vaccine. And this is going to take time and effort and resources.
And this speaks to not only those within the homeless population, but our general population total. Because, you know, I'm sure you've had a number of conversations with people saying, I'm still not sure. I'm still not sure about getting this vaccine. What is your message to them?
We need to normalize these conversations. We need to be compassionate about how people feel about these discussions. We need to be clear about the science, how we got here in developing the COVID-19 vaccine. And finally, we need to be creative with our messaging. We need to use social media. We need to connect with leaders who are trusted in the community. We need to use the ethnic media and really be having these conversations on the regular so that we get the optimal uptake in the COVID-19 vaccine that we need to beat this pandemic.
Dr. Dosani, I want to get your take on, we were talking about these tiny shelters, the story about a man, and there's now a court injunction against him in the city of Toronto, building these structures for those living in parks, you know, looking for a safe, warm place to live because our shelter system is overrun by a number of COVID-19 cases. And we saw protesters outside Mayor John Tory's condo building over the weekend saying, listen, drop this injunction. How can you see both sides, and how do you find a happy medium somewhere?
I think the story about the tiny shelters is an unfortunate one and is a consequence of the lack of affordable housing that we have in the city and in many cities across Canada. You have a gentleman, Khalil, who is has an incredible soul and heart and trying to do good in our society, and is falling victim to a city that just hasn't provided enough housing and shelter for people to keep them safe. We need to work with people like Khalil and others who are doing great work in the community. And you saw a large community of support rally behind him and the tiny shelter cause yesterday for good reason. We must do better. There are over 14,000 people living on the streets and during this pandemic, and they need housing. They need housing now.
Dr. Naheed Dosani, thank you for your time today. Appreciate it.
Thanks for having me on, Melanie.
All right, 7-Eleven is what we're sitting at this Monday morning. We're gonna, if I can get my words, we're gonna go on over like a lion to Devo Brown.